right, today we are going to be talking about a carrying angle. So the carrying angle is the angle formed between the humerus and the ulna when the arm is extended at the elbow. And when assessing the carrying angle, you may see a potential difference between the sides of the bodies or abnormalities like cubital valgus, which is increased angle, or cubital varus, which is a decreased angle. And it's important to assess this in your initial evaluation of the patient because it can add information to your evaluation when you understand a patient's movement patterns or lack thereof, risk of injury, and it can form your interventions moving forward. So a normal carrying angle is for males 5 to 10 degrees, and for females 10 to 15 degrees. All right. Hi, Mike. How are you?
Good. How are you?
My name is Annie, and I'm a student physical therapist at the University of Pittsburgh. And I hear that you're having some elbow issues, and I just want to do an evaluation on you. Is that okay?
Yep.
Your arm and your forearm and the angle that it forms at your elbow here, I'm just going to measure that side to side to see if that can inform me about maybe what's going on, okay?
Okay.
All right. So to measure, I'm going to line up the goniometer I'm going to have the stationary arm lined up with the midline of the humerus and the movement arm with the midline of the radius and the fulcrum over the elbow joint. All right, so we have 8 degrees on the right side. And we have 8 degrees on the left side.
Today I will be showing you how we perform and assess the lateral ulnar and lateral collateral ligament of the elbow, doing one of the 3 posterior lateral rotary and stability tests. So Braden, is it okay if I do a test with you today to assess how stable your elbow is?
Yes.
So to start off, what we're going to do is we're going to bring the arm into about 120 degrees of flexion with the shoulder in external rotation, and then we're going to take the forearm and we're going to supinate that as much as we possibly can. And then what we're going to do is, starting in this position with the elbow slightly flexed, we're going to apply a valgus force, and then we're going to extend and flex the elbow while applying that valgus force and that axial load as we're bringing the elbow down, pushing into the humerus. Positive sign would be at about 40 degrees of flexion. We would hear either an audible clunk, or we would see visual dimples on the lateral side of the elbow due to that instability of the ulnar and lateral collateral ligament. We would want to compare both sides bilaterally just because some people are hypermobile, so we want to assess if this is abnormal for them or if this is their baseline.
I'd like to do a test on you today called Tinel's test, and that's one of the tests that we use to assess for carpal tunnel syndrome. So if you have any like numbness or weakness in your hands, comes from that median nerve that gets trapped in that carpal tunnel.
Okay.
All right, is that okay with you?
Yeah, sounds good.
So what I'm going to have you do is lay your hand palm up on the table here. Good. And so all I'm going to do is kind of tap on your hand and wrist area a few times, and I want you to let me know if you feel any of those tingling or numbness symptoms.
Okay.
All right. All right, did you have any tingling or numbness with that?
Oh, no, I didn't.
Okay, good. So that would be a negative test. A positive test is if you did have some of that tingling and numbness and weakness or anything, and it would be specifically more like in your thumb, your finger, your middle finger, and then a little bit in your ring finger.
Okay.
Today I will be showing the triangular fibrocartilage complex, or TFCC, load test. This test is going to look at possible tears of the TFCC or a ulnocarpal abutment. Positive findings for this test would be reproduction of the patient's familiar symptoms or also crepitus. And this test would be done bilaterally, but for the sake of this video, I will only be showing it on one side. Alright, Jasenia, so I'm just going to do a test for your wrist. There's a lot of structures that you have kind of in this pinky region here, and so I'm just going to put a little bit of a load, and you're going to let me know if that's going to feel or give you any symptoms, okay?
Okay.
All right, so go ahead, relax your hand. So I'm gonna stabilize at the wrist. I'm going to ulnarly deviate her hand and apply axial load. And then I can also move the hand volarly and dorsally. Is there any pain there?
No.
Okay. And again, we would perform this bilaterally, but for the sake of this video, I will only be showing one side.